There are calls for a mass media campaign to encourage vaccination against COVID-19. This as vaccine hesitancy appears to be a growing problem. The SOS Coalition says the campaign should be aired at prime time slots to reach the most number of people. Joining us now for that conversation is the coalition's project coordinator, and that's Nimrod Geva talking to me now. And Nimrod, I thought we were doing that already, but perhaps being a broadcaster, working in a broadcast institution, I was quick to give our industry a pat on the back for a job well done. You believe more can be done?
Absolutely. We can see in the numbers of people getting vaccinated that we do have a bit of a slowdown at the moment. After millions and millions of people rushing to get their vaccines, we need to keep up that momentum, and concerns, lack of information, misinformation, we've got to address that head on and get people vaccinated so we can prevent or at least delay a fourth wave until we can reach higher numbers of vaccinated people. I think there is so much work to be done, especially in the wake of the DigiVive scandal, that has to change the game in terms of what we tell people, what we inform them about, and get them out there to vaccinate.
So if we were to take the war metaphor a bit further, there was an admission a few days ago in an interview with Bongani Bingwa by the health minister that it would seem that in the battle that we are fighting against disinformation and misinformation, vaccine hesitancy and anti-vaxxers, in as far as their propaganda, they seem to be winning the battle at the moment. The health minister saying that they seem to be doing more. And you mentioned the situation with digital vibes, which was really money down the drain in as far as effective communication is concerned. So what does it look like for you, though, pushing back against dis and misinformation on vaccines and also on COVID-19?
And so firstly, we need to get the right message out there, because we know that misinformation has a tendency to shock people, and people share it out of shock, not necessarily belief. And so there's a whole kind of counter-campaign as well. And not just misinformation, we need to give people the right information. They may not be concerned about outlandish conspiracy theories, but they may have other kind of lack of information or concerns. So it's about being in prime time. It's about reaching people where they are when they're watching the soapies, and not leave that just for corporate advertising and spending. So we need the broadcasters to pony up, to donate airtime, to give that vitally important message, the ability to reach the millions of people who are watching their channels. In addition, we need social media to allow paid advertising from health organizations. There's an organization called COVID Comms, for example, that's doing a lot of good work, because they only allow people who've been approved by the government to post information, and that is understandable because of the disinformation, but also very constricting in terms of other NGOs and organizations with very important messages to get through. And then we need YouTube, we need Facebook, we need all these media platforms to take part of the burden. We can't just leave it to government. We have to stand together and share the message. And if that means donating airtime, it means donating advertising space, that's good citizens should do that, and self-interested citizens should do that as well, because if we have more lockdowns, there'll be less advertising and there'll be less economic activity, and the broadcasters will suffer, as we've seen them suffer in lockdowns previously.
Is part of the problem, part of the challenge, Nimrod, not the whole issue of how do you package this key information, vital as it is, in such a way that it doesn't come across as bashing the audiences with this, constantly bashing people, but presented in a way that says you need to know this is hugely important, but at the same time keeping audiences interested, right? And while I ask you that question, let me also take take advantage of the fact that I believe you are in production, in the production space as well, to say one of the things, for example, if you're talking primetime space, one of the things I've wondered about is that in the popular soapies that you mentioned, it would seem that COVID-19 doesn't exist. You hardly see people wearing masks and sanitizing. The subtle insertion of the messaging in those popular media products is not happening, including by industries such as yourselves.
Absolutely. So just to correct, I'm not the national coordinator. I'm a volunteer member of the SOS and a television producer. And I think I've stressed information, but as a television producer, I know that stories, characters are what people connect to. And I think there's lots of opportunities to develop messaging that isn't just informationally based, that kind of really gets people in their hearts and minds and is more entertaining. It doesn't have to be boring. It doesn't have to be statistics. It doesn't have to be paternalistic and didactic. It can be fun, believe it or not. And that's the space we're looking to be brought into. Absolutely, the soapies, some of them actually have developed some storylines, but it's something that the broadcasters can also encourage from their side. It is a difficult situation to shoot with a COVID reality all around, but it's something that we need to do and bring into our fiction and not just our reality, and show people what can be done in those contexts as well. So I agree with you.
All right, Nimrod, thank you so much. It's a noble call that you are making. Absolutely. We should amplify the correct information, science-based information, lead with science, even as we allow all sorts of debates on the interpretation of the science, but the core message should really be led by the science itself. Nimrod Geva there from the SOS Coalition talking about the call for broadcasters and other media to dedicate more primetime space towards messaging around COVID-19 and the vaccines.